one of the things that was just such a blessing that I wouldn't have actually known was a priority was to build relationships with national leadership, especially within the Ministry of Health. I was invited just within 2 weeks of arriving, I was invited to the first ever meeting to think about could we ever do these AIDS treatments called antiretroviral therapy in Africa. And at the first day, we were thinking, wow, this would be great. These medicines are getting cheaper and they're very effective. They decrease the chance of dying. The second day, they talked about side effects, the importance of adherence, and the complexity of the systems to make it run. And I think most people left thinking, I don't think we could ever do this in Malawi. Malawi is a place where only like 10% of hospitals could deliver even the most essential health services. And to think that we could do this big treatment program for this complex disease seemed impossible. But yet, because I was at that meeting, I was invited to the next and the next and the next, and found myself in a technical working group to develop the strategy for how we could do it. It became clear that the Lord was calling us as a group there to do HIV, and we started what's called Partners in Hope that had from the beginning no U.S. board. It was all Malawian. It was a Malawian board, and ended up starting this clinic that had a focus on HIV and indeed had a free clinic for HIV because a lot of the patients with HIV who were poor were willing to go forward and get care for their HIV. But the people who were in the higher echelons of society, the members of parliament, the pastors, the teachers, the public figures, the stigma was so high they couldn't show up at an HIV clinic and get care. And so our strategy was to have two clinics, one that was a private general clinic. And so we were caring for the upper ups of society, giving them antiretrovirals, and they were paying fees. And then we were caring for the poorer patients in our free clinic. But it was a way for us to increase volume, but also address some of the people that weren't getting care. And from the beginning, my philosophy was one of the things I want to do is have this be a Malawian organization run by Malawians. And it came time as we went through it was about 12 years really from the beginning to the end when we left, where we had some amazing, very bright, capable Malawians who were running most of Partners in Hope. Since I left, Partners in Hope has tripled in size. They're the largest NGO in Malawi, as far as I know, with about 1,500 employees working in 9 districts, caring for well over 200,000 people on HIV treatment. And as a part of that, they're also building capacity at about 135 different facilities in all of these districts. So it was something that the Lord started as a little seed in me, including a very strong sense of that we didn't want to build sort of a temple to me or a hospital that was run with support from abroad, but that it was very local and run by the people that God would call. And that to me was so beyond what I could have accomplished. I had thought about the really that some of the things I had learned from those years. One was that one doctor working his buns off trying to take care of patients doesn't have as big of an impact as putting in systems and empowering others. And so I began having more increased awareness of the importance of training other people, nationals who can take these organizations far beyond what we as expatriates, as missionaries could. And at that time, Rick was really working on kind of conceptualizing the Nationals program. And when he first mentioned it to me, it was like, that's it. That's what we should be doing is really funding the people that God is calling from these countries to train them to be doctors, and not just doctors, but healthcare leaders, and not just healthcare leaders, but people who are really considering their career as a doctor to be their mission in service of the Lord.